Welcome to this 11th webinar on advancing the care reform agenda using the systems strengthening approach. We're delighted that you can join us today. My name is Florence Martin. I'm the Executive Director of Better Care Network, and I will just introduce this webinar and our moderator. But first of all, also a little bit of housekeeping. So this webinar is going to have a Spanish interpretation, and we just want to make sure that you are clear about where to go. You will see a little button with a little globe at the bottom of your Zoom screen. Please go in there and select the Spanish channel if you need Spanish, or the English channel. And I've introduced myself. Thank you. So this webinar is hosted by the Transforming Children's Care Global Collaborative Platform. It's the 11th of a series. The collaborative platform establishes more strategic sector-wide collaboration, building from colleagues working at global, national, regional, local level to strengthen children's care and care system. It's a community of over 600 people, organizations, network globally. We will, if you're not already on the platform, we will give you a link in the chat for you to join. We also encourage you to introduce yourself in the chat box. I've mentioned that it's being recorded and the recordings will be made available to you both in Spanish and in English. So do please, if you have a minute, introduce yourself in the chat. We will be using the Q&A function, which you'll see on your screen, to ask questions and also for you to upvote and comment on the question of other attendees. And our panelists will be also responding whenever possible, the questions directly into the Q&A function. So without further ado, it's my great pleasure to introduce our moderator, Cornelius Williams, who is the Director of Child Protection at Unicef. Cornelius, we're delighted to have you here. I'm handing over to you the moderation.
Thank you very much, Florence, and I want to thank the entire BCN team for inviting me, actually, because this is really an important agenda. So good morning, good afternoon, colleagues. I see more and more colleagues are joining. I'm Cornelius Williams, as Florence said, Director of Child Protection in UNICEF. I'm the Global Director. Welcome and thank you for joining the webinar on advancing the care reform agenda and using the systems approach. Let me immediately actually go. I'm pleased to introduce the panelists today. And first, I will introduce Experience. Is the head of Child Rights Promotion and Protection Department in the National Child Development Agency. Then Leon, who is the Chief of Child Protection in UNICEF Rwanda. And finally, Annie, who's with me here, is the UNICEF Global Technical Lead on Child Protection System Strengthening. I would also like to thank Florence and the team, as I said before, at the Better Care Network for organizing this webinar and for providing us with this platform to share experiences and reflect together how the system strengthening approach are relevant to the care reform agenda. Next slide. So, next slide. Thank you. In today's webinar, we will start with a presentation of child protection systems approach, and then hear about Rwanda's experience on how this approach contributes to strengthen the care reform agenda. Following the presentation, there will be a question and answer session, but please feel free to use the chat session to ask questions. We'll be monitoring the chat session, the chat box. And so at this point, actually, let me invite Annie. Actually, he will be making a presentation on UNICEF Child Protection Systems Strengthening Approach. Annie, over to you.
Thank you so much, Cornelius. And let me join Cornelius in thanking the Better Care Network and the collaborative platform for inviting us to share our child protection system strengthening approach. as Cornelius mentioned, we will focus and zoom in on our child protection system strengthening approach. In this presentation, which will be about 15 minutes, I will talk in three parts. First, I will take us very quickly through our newly launched child protection system strengthening approach that was launched in 2021. Then we'll talk a little bit about how Unicef is proposing a comprehensive measurement framework for measuring our work on child protection system strengthening. And finally, in part 3, I will touch upon some high priority interventions and a method that we have devised to identify high priority interventions. You can download all these resources on the link that is provided at the bottom of this particular page. And once you have the PowerPoints available to you, you will be able to access this link. And we will also, during the course of the webinar, post this link in the chat. If we could go to the next slide, please. So just a very quick background on the evolution of UNICEF's CPSS approach. As all of us know, we have been investing on child protection system strengthening for a very long time. And UNICEF has, way back in the 2008 child protection strategy, recognized the importance of investing in system strengthening rather than doing only piecemeal issue-based work. And that strategy really identified what we have all remember very fondly as the protective environment framework and those 8 elements of the protective environment framework. So UNICEF has been working on strengthening child protection systems for almost 2 decades now. But interestingly, in 2018, we did a very comprehensive global level evaluation of our work on CPSS, or child protection system strengthening, which actually shared some really interesting findings and provided us some solid recommendations. You can download that report as well that you see here. But the most recent development that has influenced our child protection system strengthening approach is our 2021 to 2030 child protection strategy, which has very clearly identified an inclusive and effective child protection system strengthening as one of the 3 core strategies for strengthening child protection globally. So this is really the background based on which we have evolved our child protection system strengthening approach. If we could go quickly to the next slide, please. So as I was mentioning, the 2018 evaluation highlighted some really critical findings and recommendations. Interestingly, one of the findings was that while we had done some fantastic work on strengthening child protection systems globally, there is a lot of buy-in at the country level from governments, from the civil society and other actors on the importance of child protection system strengthening. We have seen that there was in 2018 when the evaluation was done, there was still a lack of clarity on what is that holistic child protection system strengthening approach. And what we have done through this resource that we are going to talk about today is that we have clarified that what that approach really is. And to do so, we have identified 7 or 8 key considerations that influence our approach, which we'll see over the course of the presentation. And we have identified some key elements or intermediate outcomes that are essential if we want to strengthen child protection systems. Secondly, the 2018 evaluation also identified that while a lot of work has gone in on strengthening child protection systems, we need to be able to identify what are those 5 or 6 key things that really move the needle in terms of system strengthening. And the evaluation actually gave us pointers and provided solid evidence on some of the key investments that have actually moved the needle to strengthen child protection systems. So what this resource also does is that it helps identify those 7 or 8 high priority interventions, as well as some critical entry points as to where is it best to invest in some interventions during the course of the system strengthening trajectory. And lastly, one of the very important recommendations of the evaluation was that we must invest in measuring the progress and performance of CPSS. Because we have not done enough, we have done a lot of investments, but we are not been able to track the progress. We are not been able to measure the progress that has been achieved through investments. And therefore, this resource proposes a phased approach to child protection system strengthening and benchmarks for measurement. If we could go to the next slide, please. And the next, please, sorry. So these are some of the key considerations that influence our child protection systems approach. I'm not going to go into the details of each of these 7 dimensions that you see here on the screen, but very quickly we talk about the relationship between child protection systems and the larger child protection services, the role of communities in child protection, the importance of child participation in child protection systems, the relationship between issue-based programming and the larger system strengthening work, the relationship between humanitarian work and how it actually fits very well within the larger CPSS work, and so on and so forth. When you look at the paper, I would urge that you look at these 7 considerations that have been articulated in the resource in more details. Next slide, please. So what we've done through this paper is that we have proposed a logical framework of how child protection systems result into that ultimate impact that you see on the right side, which is every child is protected from violence and exploitation. And what we do really to do so is, of course, on the left-hand side, you see those core investments that we talk about, but really zoom in on achieving those intermediate outcomes, the 7 intermediate outcomes that you see in the center. If you could go to the next slide, these are the 7 intermediate outcomes that this approach for child protection system strengthening really advocates for promoting, ranging from legal to policy framework to governance coordination structures, not just at the central level, but coordination structures at the central level, the state level, the local level, as well as horizontal and vertical coordination structures, a continuum of services, both prevention and response services, minimum standards for services, and very importantly, oversight mechanisms. Of course, a lot of focus in these 7 intermediate outcomes is on element 5, which is human, financial, and infrastructure resources. Then we talk about the minimum mechanisms for child participation and community engagement, noting that the evaluation actually said that a lot needs to be done to strengthen child participation in child protection systems. And last, but very importantly, data collection and monitoring systems that contribute to strengthening child protection systems. So these are the 7 core intermediate outcomes that really we advocate that will move the needle if we wanted to really strengthen child protection systems as a whole. If we could go to the next slide, please. And the next, please. Now we are going to talk about the phases and benchmarks for child protection. If you recall, I said that one of the critical findings of the 2018 evaluation was that we haven't really been able to measure what it means to progress over a child protection system strengthening trajectory. The evaluation recognized that UNICEF must prioritize investments in areas that will make the biggest gains, but at the same time, we are not able to identify which areas need those high priority interventions. So what we have done is that we have attempted to establish a maturity model. So to determine the level of maturity of child protection systems, fully recognizing that child protection systems do not mature over time or even in a 2 or 5 year period, but it's a long haul game, so to speak. Then to identify priority interventions, and very importantly, for us to be able to measure the outcomes of these investments. If we could go to the next slide. What we are proposing in our approach to child protection system strengthening is a 4-phase model of system strengthening, which goes on from phase 1, that is system building, to phase 4, which is system maturity. Now, just a couple of points wanted to mention here is that these names that I've identified in terms of building, enhancement, integration, and maturity, there is a lot of conversation that happened internally. And we recognize that we need to be able to identify some name with which we will be able to associate the phase, rather than just calling 1, 2, 3, and 4. And one of the reasons why we identified these was because in the phase 1, in very early building stages, we are still focusing on identifying those key building blocks of child protection systems. As we are moving to the next phase, we are looking at focusing. The focus is really more on enhancing those individual blocks of child protection systems, like a lot of focus on strengthening individual child protection legislation, for example, a lot of focus on, say, establishing a national level child labor coordination mechanism or an anti-trafficking mechanism. So really the focus is still on enhancing individual building blocks. As we move to the third phase, we're talking more about integrating the various elements and various dimensions of child protection system. For example, you start seeing national level child protection coordination mechanisms instead of having 10 different coordination mechanisms running parallelly. And phase 4, which is the maturity phase, is really where you start seeing the results being achieved, where there is increasing reliance and recognition of the importance of very strong independent monitoring mechanisms, and so on and so forth. So really the system matures over this 4-phase trajectory from system building to system maturity. Just one more point to explain that the child protection system and all those 7 elements that we speak about do not move in tandem. Some elements move faster, some elements are slower to move. The other important thing to also recognize is that some elements might actually move from phase 3, for example, to phase 2, because there could be an emergency, there could be a humanitarian situation. Suddenly the investments drop due to a global and local financial crisis. So it's not necessary that it is always one way. Although you see those arrows, our ambition is that systems will continue to mature over time, but it is important to recognize that parts of system may actually draw back because of external context. Next slide, please. Then we talk about the benchmarks. Now, how do we really measure the progress? So for that, what we have done is that we have identified a comprehensive benchmarking mechanism for this child protection system. So for each of those 7 intermediate outcomes that you see on the left-hand side of your screen, we have identified subdomains for them. So we are talking about 19 subdomains across those 7 intermediate outcomes. And we have actually articulated our attributes of each of those 19 subdomains across that 4-phase trajectory of child protection system strengthening. So this is really an architecture for our benchmarking system where we are able to look at each and every subdomain. For example, if you look at 1.1, we are talking about articulation of CP system. And when you look at those descriptions, you're able to see where the system stands at a given point in time. So
Annie, my apologies to interrupt you. Can you slow down a little bit? Our interpreters are having difficulty. Thank you.
Okay, sorry. Next slide, please. And what we're doing is that through our strategic plan at UNICEF, we have committed to globally track the progress of these benchmarks that we have established. So now we have committed in our strategic plan to our executive board that we will, on an annual basis, report on how our child protection systems are moving from one phase to the next over the next several years. And at the country level, we are hoping that this assessment, as it matures, will be done extremely comprehensively and collaboratively with our partners. And for that, we have developed a user guide on how to do it. On this screen at the bottom of it, you can see a link to that user guide. Please download this document, share it with partners so that we can build really a community at the national level to be able to measure child protection systems maturity more collaboratively. Next slide. So just a very quick glimpse. In 2021, we gathered data from 155 countries on these 19 subdomains and where the systems stand. And this is what we got as a result. So this is going to form really our baseline for the next 4 or 5 years. We are talking about one country that self-reported that the system is at the maturity level, and 39 countries reported that they are in phase 3, that is system integration level, and so on and so forth. We are hoping that we will be able to monitor it continuously over the next 4 or 5 years and even beyond that. If you could go to the next slide, I just wanted to, sorry, if you could go back, thank you. A quick glimpse of where the world stands in terms of those 19 subdomains. What we have been able to do is that we have been able to identify some areas where countries have progressed a lot. For example, there is a lot of countries have lead ministries and agencies. There are a lot of progress on articulation of child protection systems. There is very good progress on legislation. But at the same time, we see that there are challenges to data systems governance. There are challenges to minimum standards, oversight mechanism. You can see a lot of countries are not doing very well with human financial resources and so on and so forth. If you could go to the next slide. This is just a random country that I've picked, and it's anonymized, but it is actually data from one country office that we received. What you see here is actually a visualization of how the 19 subdomains are over the course of child protection systems. And we will be, over the next few years, we'll actually superimpose layers on this to see how the maturity goes. So this is really a dashboard that we are developing, and hopefully we will also have it for public consumption over the next year or two. If you could, I think that is the end of my presentation. And I would actually like to stop here because I've realized that there is another set of presentation, but I'm also looking at my time. So apologies for running it, but we will be sharing this presentation with you. There is a full segment on high priority interventions, and we will be happy to also connect with you later on that segment. But if you don't mind, I will stop here. Cornelius, thank you.
Thank you, Annie. Thank you, actually. And I'll ensure to speak slowly as well. So Annie has given us a good presentation. He's showed us the background from the evaluation to how UNICEF has responded to that evaluation. He was clear that we can now make an informed decision on priorities and where and how to invest. He covered the 7 intermediate outcomes that provides clarity on what it means to strengthen the CP system holistically. On the ground, work often involves strengthening some of all of these immediate outcomes. And he showed that this work is long-term, delivered in a gradual manner, right? And this is what we need to do to move the needle. And we can tell if we're going in the right direction. We now have a way of doing the measurement. He spoke about the maturity model and its 4 phases and the justification for the title. And again, for practitioners on the ground, I used to be a practitioner as well. This would be guide you. And I was in a country, in one country in Eastern Southern Africa recently, and I saw how the government was using this approach actually to assess their system, right? And they came to the conclusion that out of the 7 immediate outcomes, actually, they were weakened 2 of them, right? So, Experience and Leon, I'm going to go over to you. I am Experience. Again, actually, we have the honor and the opportunity to have a government who can be able to tell us what it means to apply or to strengthen their system for care reform. Experience, actually, when I was in the regional office in Eastern and Southern Africa, we used to fly to Rwanda, right, to see the work that was being done there. And I'm so excited to see, again, as Annie has said, the gradual, approach that you've taken to this work and how this work has been able to develop over time. Over to you.
Yeah, many thanks, Cornelius. Many thanks to Better Care Network for organizing this webinar to be able to share our experience as Rwanda, our journey toward building a strong child protection system. So yeah, I'm happy to share the government of Rwanda's experience, and I believe to inspire many people, being those attending this webinar, and beyond this audience. Can you put on the presentation, please? Thank you so much. Next, please. We are going to co-present with my colleague. Maybe before I start, I can give a floor to Leon to introduce himself before we start presenting. Over to you, Leon.
Sure, thanks, Esperance. And I think Cornelius earlier on introduced me. I'm the Chief of Child Protection in Unicef Rwanda. And we are, as Esperance has indicated, going to co-present. Esperance is going to take the first slides and then I will come towards the end. But as you can see from the slide that's up right now, the presentation is going to give a brief sort of background information on childcare reform in Rwanda and the process, the childcare reform process, and then how childcare reform has been used as an entry point into a CP, into a child protection system, and then how the system has been evolving to a point where we are now trying to work a little bit more on further strengthening the system. Over to you, Esperance. And you can flip to the next slide as well.
Yeah, thank you, Leon. Actually, the care reform in Rwanda was informed by the existing laws and policies, being the national one and regional and global. Because starting from the constitution here in Rwanda, everyone believes that a child belongs to a family. The care reform strategy that was developed in 2021 was actually triggered by the Children Forum Summit that was organized in 2021, as well as the National Survey on Institution Care that was conducted in the same year. So both recommended to have a national strong strategy to integrate children from orphanages to family-based care. From there, I want to mention that this survey was done by the Ministry of Gender and Family Promotion, which is our line ministry today, and which is in charge of child protection related matters. Of course, this work was done in close collaboration with the other stakeholders, including Hope and Homes for Children, which I'm sure they are present today. After the establishment of the strategy, then we were supported by the UNICEF and the other partners like USAID to establish a strong child care reform program that we called Tubarerere mu Muryango, or TMM, just to easy the language. The program was put in place just to make sure the strategy is fully implemented. Next, please. From then, the TMM program, the Let's Raise Children to Families, which is the meaning of Tubarerere mu Muryango, was put in the government's high-level planning documents, including the current 7-year government program, which is the National Strategy for Transformation. So the strategy calls for raising all children into families, reintegrating all orphans into family-based care, make awareness of the importance or the benefit of raising children into families. It also called for a strong child protection system, especially at community level, supported by volunteers, which we call commonly Inshuti z'Umuryango, Friends of Families. Those are strong volunteers in place. So the strategy calls for action to support a strong child protection system. So the care reform is embedded into the policies and strategies for the government. Next, please. So the implementation of the care reform went through a long process, but I tried to summarize that process into 4 actual steps. One, we started with raising awareness and engaging the community at large, especially local leaders, religious leaders, because most of the time they were the ones owning actually the orphanages and institutions. We wanted to have even families ready to support the care reform. So raising awareness, engaging the communities was very important to make sure the child care reform is a success. We had also to put in place a strong workforce comprised of social workers and psychologists. We'll see details in the next slides. The workforce was needed to ensure we do proper case management, we do proper placements, and we do even post-placement follow-up. So we had also to do monitoring, reporting, and evaluation to make sure children are placed in safe families. Next. The care reform actually was an entry point to child protection system because first of all, we put in place for the first time a strong professional workforce comprised of 68 social workers and psychologists. We put in place those professionals based on the institution because as you saw in the first slide, we had 33 institutions in place at the time of the survey, and we had to have at least 2 professionals by each institution to make sure they do proper assessment of the institution, proper assessment of every single child in the institution, and also do the tracing, family tracing, placement, and monitor the well-being of children into families. So that was the first cadre of professionals put in place in Rwanda. We also made sure these professionals are trained and their capacities are built to deliver on their mandate. As of now, 91% of children have been removed or safely placed into families from orphanages. And the orphanages or the child care institution, they were transformed into child-centered community-based structures. That's also something we are proud of. That's also something we are very grateful to our professionals because those centers changed into schools, they changed into daycares, which really now they are contributing to building actually strong system. Through this professional workforce, many families were supported psychologically, financially, and also the workforce contributed to avoid further separation between children and families. And again, regular follow-up to children reintegrated by professionals is something that has strengthened the families and built a strong system to protect the children who were placed in those families. Next, please. At the beginning, people were thinking, even decision makers, you guys, what are you doing? you are spending a lot of years just doing the integration of just 3,000 children, but it was not actually the intention of our program. We wanted to make sure children are placed into the families, but again, offer as much as services to the community and children to make sure we start building a strong system as even the strategy was suggesting. So we've done a lot of work starting from building a strong database of foster care families. We have just supported the reintegration of young adults. Just didn't mention how hard it was at the beginning to reintegrate young children, because it was very difficult because they were somehow resistant. We had also to manage their emotions, provide psychosocial support to children, to families, to the community, and ensuring we provide proper reintegration package and ensure children remain with their families. So from the services we provided, it's where we just realized that we need to build a strong system, not only to keep children into families, those ones who were reintegrated from orphanages, but also preventing further separation. Next, please. After actually putting in place the system, the program in place, I mean the Tuarere Muryango program, after putting in place professional social workers, psychologists, after providing the development, the capacity development. So we realized that given how the program was opening up to more demand from the community based on the prevention work we were doing, we just realized that having only 68 professional social workers was not enough to respond actually to the demand of the community. So workforce, parasocial workforce was created, the Inshuti z'Umuryango I was telling you, and it was actually the starting point of building the care reform, building a workforce that is beyond the care reform, and we started even dealing with government, I mean partners like Unicef, USAID. We started to think how the program could be fully owned by the government. Since then, the government managed to absorb such a social workforce and even invest in the new parasocial workers around 30,000. Next, please. You see in the next presentation how many people we have in terms of volunteers. At community level, the village is actually the basic or the lowest level of administrative entity here in Rwanda. So at that level, we have two parasocial workers. One is a male and the other a female. And they are providing services, including prevention and the response and the referral of child protection cases. So we feel now very supported. This is a very developing, very quick developing workforce at community level. And thanks to the support of partners, but also the government initiative, these people are doing a great job. You can't imagine how they're reporting cases, how they're referring cases properly. And of course, as government, we are providing our support as much as we can to make sure they get materials, they get facilitation to make sure they deliver on their mandate. Next, please. One of the challenges we have had during the integration of children from orphanages to family-based care was actually the integration of children with disabilities. Because during the assessment of the child care institutions, we could find that in those institution orphanages, there were many children, but beside with disabilities, and beside those orphanages, there were other institutions with children with disabilities. So one of the challenges, we didn't know how to do how to do the integration of children with disabilities. Then we thought of putting in place guidelines that to ensure inclusive care reform. So far, we managed to reintegrate 64 children. We still have a long way to go, as we still have more than 100 children still living in institution. So, but again, we are so happy because at the beginning it was very difficult. Even the community was not supportive. No one was actually understanding how a child with disability would go back in the community and get to be integrated as other typical children. So we are very happy that we managed to do that. We have partners, government, and the NGOs who are part and parcel of this process, and we are happy that it's moving. Next, please. Yeah, I'm happy to say that from what we've been doing since 2012, we are now toward a strong child protection system. And I would like to call upon my colleague Leon to go on with showing you where we are. And I thank you so much for your kind attention.
Thank you so much, Esperance. So taking over from where Esperance has left in terms of the work that has been done in Rwanda, particularly by the government with support from partners like ourselves, Unicef, and other key partners like Open Homes for Children, Save the Children, and so forth. We have seen the transitioning and transformation of the care reform into sort of the building blocks for a child protection system. So the care reform has been the entry point into looking at a child protection system evolving and developing in Rwanda. Just as an example, as you can see here, from the workforce initially recruited and put in place specifically to focus on care reform, these are now in districts. So like Esperance indicated earlier, initially they were in institutions, but now the 30 that have been absorbed by government have now been placed into district offices. So one in each district at the moment, and we are working with government to have at least two to sort of deal with the increasing caseload of general child protection cases. But those are just a few statistics in 2020, especially the year that COVID started, in terms of those children that were reached, different categories of protection violations that were reached by the workforce. All right, next slide. Right. And one of the key elements for child protection, and I think as in the earlier presentation by Annie, we saw the importance of coordination. And this is also one of the elements that were built during the care reform process, particularly looking at coordinating the different partners that were involved in the care reform process. But now, this is now being looked at in terms of broader child protection coordination, building on the investments that were made during the initial phases of care reform. So you find child protection coordination is, in terms of the national coordination mechanisms, part of the cluster system that is available here in Rwanda. And there is a national subcluster that looks at gender, child protection, and so forth, and a technical working group that is specific on child protection and early childhood development, where government and multiplicity of actors come together to discuss and look at areas of coordination across different elements of the system. And this is also being replicated all the way down to the district and sub-district, where we have what we call sectors. This is work in progress in terms of the cascading and making sure that those structures are also strong at the community level, but where investments have been quite significant at the moment is at the national level. And you'll see, as you can see in the slides, there are other mechanisms of ensuring coordination. Next slide. Right. Again, in terms of strengthening monitoring and evaluation, this is also something that was built on to the achievements and investments made during the care reform. And there's ongoing tracking of processes and making sure that there is collection of data. There is working together between government and different partners to do joint undertakings to see what is taking place in the field and be able to identify areas where corrective measures are needed. Also, in terms of evidence generation, this is also one key element that really is built on to practices established during care reform. A lot of documentation, learning, and continued generation of evidence to inform not only on care reform, but now as we go along on other areas of child protection and also even on different issues. So we are going system, but we are also cognizant of key issues that would also need a bit more attention so that we are all moving together. Next slide. Right. So one of the important issues that I can say is over and above the overall government coordination has been the realization that as we move more towards trying to consolidate and strengthen the system, we need to understand where we are at the moment. What is the current status of different elements and components of the system? And we undertook a child protection system assessment, which is being finalized right now, but sort of information, the information that is coming to us in terms of the findings and also the emerging recommendations relate to almost, in fact, all the different elements of a system as indicated earlier by Annie. Yes, we do have, for instance, very good legal frameworks and policy environment, but we need to do a little bit more in terms of implementation, in terms of consistency, for instance, when it comes to policies and legislation. And it's across in terms of coordination, in terms of governance, in terms of workforce development and support, in terms of the service provision matrix, both in terms of prevention, but also more importantly in terms of response services. And also one emerging actually finding in that regard is that we tend to be investing less in prevention, and that is certainly an area we need to work on more so that we reduce the number of children who find themselves falling through the cracks. And also more in terms of government coordination and working together in terms of resourcing the system. That is also one of the biggest gaps when it comes to making sure that we leverage more fiscal support towards child protection. And that is becoming more and more apparent, but also possible because of government leadership and also the role of data in sort of pointing to areas where more investments are needed. We are also at the moment working on development of a child protection case management framework, which is now focusing on consolidating the service provision matrix. And we are looking at this as one of the game changers when it comes to service provision in child protection in the country. And this is also one area where there is a lot of integration of partners with government leadership, and also making sure that there are more investments from government towards a more sustainable system. Next slide. Okay, I will not speak much to this slide, but it just shows the ongoing work towards continuing to consolidate the system, in terms of strengthening monitoring and evaluation systems, again working with other partners like Data for Impact, for instance, partnering with governments to come up with a consolidated M&E framework for child protection for the country, but also digitization of different child protection systems. And also working more closely with social work institutions to strengthen the workforce. And also on child participation, that is also one of the key areas that we are sort of increasing efforts to make sure that there is participation of children, not only in terms of governance and influencing resources, but also in terms of influencing service provision, and also in terms of playing agency when it comes to prevention and so forth. Next slide. Right, so this is my last slide. Really, I think all the work that Rwanda has done over the years since 2012 in terms of care reform is encapsulated in this recent Commonwealth Head of State and Government meeting that was held here in Kigali in just this past month in June, where a declaration has come up on child care and protection reform, which basically has 54 heads of state and government committing to ensuring that all children in all situations grow up within a family. And that as they get into the family, they have to be strong systems that supports to retain children in those families, and at the same time ensure that no child is separated, either in terms of renewed separation or in terms of new separation. So this is, I think, one area where Rwanda is going to provide leadership in the next 2 years, where Rwanda will be chairing the Commonwealth Heads of States and Government. So thank you. I think that's the last slide. Thank you so much, and over to you, Con.
Okay, yeah. So thank you, Experience, and thank you, actually, Leon. Actually, that was really an excellent presentation. I mean, and it shows how a government, actually a national government who has the obligation on the child rights, can take forward this issue of making sure that every child grows up in a family, right? And prevent actually family separation as well. Right, the prevention work came out very clear. You've highlighted actually how to strengthen a child protection system, right? And to strengthen the social service workforce that's critical to care systems, but equally vital to the entire child protection system. And also actually critical, again, in preventing children becoming separated from their family. Similarly, you work on strengthening data systems, engaging communities like the Friends of the Family, a great example of how the child protection system can be strengthened in a holistic manner. You've moved away from an old discussion that we used to have about a binary nature of child protection, whether child protection is a community-driven or government-driven. You have shown the world, actually, that it's a holistic system, starting from the government, laying the legal frameworks, actually, and then down to the community. And you've spoken about the 7, actually, immediate outcome in some of these issues, some of them, actually, and the different components. What I'm going to do, I'm going to open up now for question and answer. And we already have in the question and answer, we have a couple of questions, which I'm going to put to you, Experience and Leon. One, can you share a bit more information on your approach in Rwanda to identifying foster care families? You did talk about how you'd identify these families. The second question, if you could take note of the question, who pays or remunerates the parasocial workers, right? And they're looking at whether the parasocial workers receive facilitation from the government. What are your thoughts on the remuneration? Any experience? People are looking for experience. This is a topical issue in child protection, especially when, I mean, we cannot have an extensive workforce. How do we do with the paraprofessionals? And how do we work with volunteers as part of a government system? How do you retain the volunteers? It's a third question. Somebody from Botswana is saying their own volunteerism is dying. And then what is the ratio, right, of social workers to case workers handled in Rwanda? That has been another hot debate in terms of strengthening social workforce and also in the care reform. I remember that debate has been out there for a long time. There are other questions, but let me pause, okay, right? And we can do another round of questions. And please, the participants are welcome actually to continue to put questions in the chat. Leon and Experience and Leon, over to you.
Yeah, thank you so much, Colin. Yeah, starting from the question around how we identify foster carers. First of all, I want to say that we have a strong communication system under the TMM program. There is a national level communication through telecoms, through radio, through TV, advertising, and inviting people to register and being a potential foster care. So at the national level, we have worked with our very common known telecom company, that is MTN Rwanda, to send messages to all Rwandans who own a phone to get a message and know how to register to become a foster carer. That's one. There are also posters at community levels. We also have in Rwanda strong organizations at community level. We have gatherings at community level that happen regularly. From there, we also provide messages to the communities, and people, they know the social workers, the psychologists who are based at the district level, they come and they register. This is the one way. After registering, then we do assessment, family assessment, to see, we have a checklist to see if a family fulfills all the requirements, and then we may say, okay, you are eligible, and once a child is available, then we can reassess again and place a child to the foster care. That is the way we actually do, but also sometimes you may find that people, this is something that is done on demand. People can come and ask for being a foster or a future adoptive parent. So this is something that is easy because we have a strong penetration of mobile phones in the communities. We have also access to strong telecoms messages, but also community organization, the way our communities gather on monthly basis, on weekly basis, we get opportunities to provide information, and then people came to the social workers to register. On the second question on who pays the salaries of professional social workers, as I mentioned at the beginning, this was done under the program financed by Unicef in partnership with USAID. But from 2017, the SATE workforce we have now is being paid by the government, not our ministry, but the ministry in charge of labor and public service. They are remunerated as other employees there at the government payroll. They get also other facilities, including communication fee, transport, and every other type of facilities other government people get. For the parasocial workers, they are not remunerated. They are just given some incentive, like toolkits to support their work, like a jacket, like something that can identify them, like other facilities, books, trainings, but also they get some monthly communication through their phones. Those are some of the facilities they are getting, but of course, the government is trying to find a way to motivate these volunteers to make sure we keep them. To the question on their maybe turnover or yes, sometimes it happens, but what we have built a database of those parasocial workers that help even their reporting, because when you keep the people working, then it's very hard to leave their work, because most of the time they are not motivated by material thing, but they are motivated by the work they are doing and the change they are seeing, making in the community. So making sure they have clear tasks, making sure you have ways to communicate to them regularly, making sure you give them some facilities like working materials. This thing motivates them more than the capacity building, especially keeping, giving them training. This is what motivates them more than like a payment in terms of salaries or in terms of money. So of course there is turnover, but it's not very high as such, and we keep replacing those who are going. So good management of the workforce is very important, more than paying them money. So maybe for the next question, my colleague can support on this one, on the ratio of workforce to the community.
Okay, yeah, thank you so much. So yeah, in terms of the ratio of social workforce to cases, we have not done a proper workforce assessment and mapping to be able to, determine the ratio. So we talk of the 30 who are currently placed in the 30 child protection and welfare officers placed in the districts. But we also do have people who are known as sector social affairs officers in every sector in the country. And while these are not like the professional social workers and psychologists that we have been talking about, they are a social service workforce available to child protection, and they do receive training to be able to do basic work in child protection. Then we have the paraprofessionals, the Inchusumriango, who are, the community workforce also available to child protection. But when we want to look at the ratio of professional, particularly social workers to children, that's something that we in the pipeline, in terms of us undertaking. We are in the process of developing terms of reference to do an investment case for social service workforce, in which we will be able to do a kind of a mapping and a proper calculation in terms of the ratio. And when it comes to skills gaps, of course, the social service workforce has actually a lot of skills gaps. As we said, the workforce was developed specifically to focus on care reform. And as they got absorbed, utilizing the same workforce, this is actually the first available workforce, professional workforce for child protection in the country, as from around 2018 going into 2019. So you can see in terms of the development of the child protection system in Rwanda, it's quite evolving. It's still nascent. It's a relatively new area as a sector in Rwanda. And obviously, we have a long way in terms of developing the workforce from a capacity and skills point of view. We haven't done a skills gap, particularly for the professional workforce, but we just completed last year a skills gap for the community volunteer workforce, which is helping us right now in terms of developing a skills and capacity development program for the volunteer workforce. For the professional workforce, this will come a long way with the investment case. As we identify, the different skills gaps. For instance, we just recently, as recent as last year, did foundational training in child protection service provision in sort of, talking about the case management concept to the workforce. So it's a developing workforce. That's one thing we are very clear about, and it's one area that we are working very closely with government to ensure that we work more towards capacitating the workforce and addressing the various skills gaps that are still there. Thank you.
Thank you very much, actually, Experience and Leon. Leon, could you adjust your camera, please, actually, downwards?
Just not that, okay.
Yeah, okay, and zoom in to you, sir. Okay, brilliant. Okay, that was really showing, again, participants, colleagues, everybody. I mean, this is showing the practical example of rolling this systems work out and doing the social workforce strengthening, social service workforce strengthening, and linking it to care. So you've had some of the responses. Let us look at some other questions. And I'm really impressed with the questions. Actually, you could see these are seasoned practitioners that are raising questions for you, Experience and Leon. The next question is, how are you supporting and protecting young people as they move into early adulthood? Again, the debates, the issue of transition in living care, which has always been a debate and so practically, how are you doing that, the transition? How do you support, the next question, how do you support foster care to understand the impact of trauma on children and young people? Experience, you spoke about the training of the foster care, right? And the training of the foster care, okay, families actually. How did you do the impact of trauma on young people? Could you give more details, okay, on the steps you've taken to include care reform in training of social worker Leon, you started talking about the training of the social workers, right, in foundational child protection, but could you expand on that actually? Let me pause at this. These are 3 questions. Over to you. How you split the question is up to you.
Yeah, starting from the question on how we build the capacity of foster carers and making sure they get all skills required to provide appropriate care to the children they are receiving. There are 2 types of capacity development we do. One, there is individual sessions with those prospective parents. Yeah, we do meet a single family. We meet them at their households. We discuss. We first of all, we know what are the intention, why they want to have or to receive a child in their family. Because normally they do, when I was mentioning how they register, they even provide the reasons that push them to ask, to request for becoming a foster parent. From there, we check if their interest, actually the best interest of the child comes first. We discuss, we get to tell them how actually heavy it is to raise a child which is not your biological child. Those are the sessions that happen between a social worker, a psychologist, and the family. There is also other sort of training or session in a group where foster carers come together and learn. Of course, there is a module that is specific to foster prospective foster parents. So those individual session plus group session is something that sharpen actually those parents, and they get even to share experience yeah, this is done on a regular basis. After even receiving children, we do monitoring and supportive supervision. We get to connect the foster parent with the inshuti z'umuryango in the community so that they can do regular visits and see how children are doing. That's one on the foster care. Regarding young adults, as I mentioned in my presentation, it has been a long journey to deal with these young people, but again, we succeeded through actually the same approach of facing one, having one-on-one discussions, and again, making the session 2 groups to get to share experience. Also bringing in a peer-to-peer approach where young adults who have been placed come and give testimony on how they get, how they live in their community, how they are coping, and get to share their coping strategies. And this has been very successful. Again, making sure if those who want to continue their studies, we provide supports. Those who want to do university studies were able to pay. Those who wanted to have specific training on let's say TVT, this is technical vocation schools were provided, making sure also we connect them to the other youth peer who are in the community. Those things, actually the resistance come at the first stage, but after having realized that this is something that is possible for us, we were thinking maybe this is the fear to face the new life, but we have been trying to have several sessions, individual and in group, and making sure we also promote peer-to-peer influence, which has given actually, which has yielded a lot of results at the end. Maybe Leon can take on the next question.
Yeah, sure. On the steps taken in Rwanda to include care reforming training of social workers. So at the beginning, when the care reform was starting, right, like we said, the workforce was developed starting with care reform, and then now becoming more available to all child protection issues. But to begin with, the focus was primarily care reform. So what the government, in collaboration with partners like Unicef and Open Home for Children, was to sort of come up with a partnership with the University of Rwanda, so the national university here, and University of Tulane to develop a curriculum for the workforce. So these are, social workers and psychologists who have gone through college and so forth, but have no prior experience in child protection, and whose training was not oriented specifically to child protection. It was generic social work, generic psychology. So the initial step was to sort of, I don't want to use the word convert, but transform them into a strong cadre who understands child protection. And to do that, then we had to work with the local university and an international university to develop the curriculum, which was used over time to continue to develop the workforce. This also was accompanied by tools and guidelines, right, developed for care reform, and their training was oriented and guided, right, by the tools and guidelines, particularly on the case management processes, from identification all the way to post-placement and post-placement follow-up. And this is something which is continuing even now. We are, as we speak now, working very closely with the workforce on how to close some of the cases, because they have remained open from when they initially placed the child, and they've been keeping that open. But we are now looking at assessing and reassessing and identifying cases that can actually be closed from the caseload of the care reform. And then we have, as recent as 2019, brought in a very excellent team of consultants, right, to one international, one local, to relook at all the guidance documents, all the manuals, all the tools, and make them inclusive. So the focus is now on training the workforce to understand and be able to support children with disabilities, and ensure that they can support those children to be placed in families. So that has also triggered a new round of skills development when it comes to inclusive care reform. So sort of ongoing training, yes, they started with care reform, but we haven't stopped. As we continue to develop new frontiers in child protection for the workforce, we are also making sure that we are working along with them and having a lot of retraining and retooling when it comes to new issues that also come along with care reform. So for instance, children with disabilities, we have issues of children on the streets that are being placed back in families. We have issues of abandoned children, that these that the workforce is also supposed to be able to place. So they are not only looking at moving children from institutions to families, but making sure that every child has the opportunity to be raised in a family. So that is what I can elaborate in terms of the ongoing capacity development and the new sort of areas that are being identified as part of a continuum of capacity development in terms of skills for the workforce.
Yeah, maybe I want to add on something in terms of the skills development. Again, the 60 or 30 people cannot alone manage all the cases countrywide. We have also trained our workforce in a way to do the referral mechanisms very clear. For example, on the question around how we manage the trauma of the young adults or foster carers, we do have specialized services here in Rwanda. It's also something that is even supporting a strong child protection, which is known as one-stop center. This is the services that are comprehensive services. Let's say at one hospital, when a child is abused, let's say sexually abused, raped, when they go at that one-stop center, they can get medical services, psychosocial support, legal support. I mean here, the investigation bureau is available just to ensure full support provided to children. So sometimes all the cases are not managed by those psychologists and professionals. They don't have even enough time to provide the psychosocial support, but they know how to refer cases to other service providers in the community. So with the case management framework Leon was talking about, we'll be able to know exactly what are the services available in the communities and how the workforce can be able to refer some cases. Again, even the workforce itself, sometimes you feel like they need also psychosocial support. We've been working with the University of Rwanda again to provide supervision, to get to clinical supervision to our workforce, to make sure they are not overwhelmed, they don't have this stress and burnout. Yeah, there are services in place that are supporting even the workforce, but also the workforce is able to refer cases to other service providers around the country, especially to those top centers who are available in all hospitals in Rwanda. Over.
Thank you very much. Thank you very much, actually, Leon and Experience. There is a question on reintegration, but I would suggest, actually, Leon, that you go to the question and answer and just type in the response, okay? In terms of the question on monitoring, which is a serious issue, right? There's a question of the purpose of monitoring is a serious shortcoming. Is data for the purpose of monitoring is a serious shortcoming in so many countries. Does the child protection system have a recommended benchmark? Ani, over to you.
Thank you, Cornelius. Indeed, I mean, as serious as is the issue, there is also a lot of progress that has happened. So we recognize that progress in strengthening data systems, monitoring systems. In our child protection systems approach, there is actually this particular concern around data and monitoring was fully recognized, and it has been designed as its own dedicated intermediate outcome on data collection and monitoring systems. And within that, we focus on 3 areas. One of those is administrative data, which is geared towards improving routine monitoring and data collection. and how do we need to strengthen routing monitoring systems that are of the government, because there is so much survey data, so much ad hoc data collection that is going on, but that all of that is not really linked to administrative data. Even in administrative data, we see different streams of admin data happening. So we really identified a specific subdomain for administrative data purposes. But I will stop there, Cornelius, and hand it back to you.
So colleagues, actually, we've spent quite some time having a really exciting discussion. I particularly like the structure of the seminar, the webinar, because it shows actually that we spoke about the theories, we spoke about a practical example of how you can roll this out. And it was clear the government's leadership around this. So during today's webinar, we've learned a lot about how important it is to take that long-term, systematic, and a truly systems approach to care, and how that paves the way for long-term reform of the care sector and the child protection systems as a whole. So Rwanda is a really good example of this, and I hope it will be documented, right? Engaging children and family and communities is vital to the success of child protection systems, as experience in Leon has shown, as they're central to part of the systems and not on the fringes of the system. Going forward, it will be important to invest in strengthening how we measure our work, right? Leon, you spoke about that, both in the care system and the child protection system holistically, and Annie, you've just spoken about that as well. At UNICEF, we're fully committed to support national efforts. We're pleased to support governments who have the commitment to child rights and to care reform, like Rwanda, to strengthen their child protection systems and the care reform work, and we look forward to working closely with all of you. I thank the government of Rwanda and the UNICEF country office, as well as the Better Care Network colleagues for organizing today's webinar. Florence, I don't know if you're coming back on, but thank you very much for everything, colleagues.
I am not. Thank you, colleagues. Thank you, Cornelius.